Many of us have felt that uncomfortable feeling in our tummy after a big meal. We often call it indigestion, but the medical term for this is dyspepsia. It's not actually a disease in itself, but rather a collection of symptoms that affect your upper abdomen. Think of it as your body's way of telling you that something is not quite right with your digestion. It's incredibly common, and honestly, most people will experience it at some point in their lives. Understanding what it is can be the first step towards feeling better and managing the discomfort it can cause. The main feeling people describe with dyspepsia is a pain or discomfort high up in their stomach area. This might feel like a burning sensation, or sometimes just a persistent ache. Alongside this, you might feel uncomfortably full very quickly when you start eating, or you might stay feeling full for a long time after you have finished your meal. These sensations can be quite bothersome and can really interfere with your enjoyment of food and your daily activities. It's important to pay attention to these feelings and what might be causing them. Another very common symptom is bloating, where your tummy feels stretched and full of gas. This can be accompanied by a lot of burping or feeling nauseous. Some people also experience heartburn, which is a fiery feeling rising from your chest up towards your throat. This happens when stomach acid travels back up your esophagus, which is the tube that connects your throat to your stomach. While heartburn is often linked with dyspepsia, it can also be a symptom of a separate condition called gastroesophageal reflux disease, or GERD. It's helpful to remember that everyone experiences dyspepsia differently. For some, it might be a mild annoyance that happens only now and then, perhaps after eating a particularly rich or spicy meal. For others, the symptoms can be much more severe and happen very frequently, making life quite miserable. The key is to recognize that these symptoms are your body's signals. By listening to them, you can start to work out what might be making you feel unwell and take positive steps to manage your digestive health. One of the tricky things about dyspepsia is that its cause is not always clear. In many cases, when doctors run tests, they find that everything looks perfectly normal. This is known as functional dyspepsia, which means the digestive system is not working as it should, but there's no obvious damage or disease to explain why. It can be frustrating not to have a specific reason, but it's a very common diagnosis. The good news is that even without a clear cause, the symptoms can still be treated and managed effectively. However, sometimes there is a specific underlying reason for the indigestion. A very common cause is gastroesophageal reflux disease, or GERD, where stomach acid regularly flows back into the esophagus, causing irritation and that classic heartburn feeling. Another possible cause is a peptic ulcer, which is a sore that develops on the lining of your stomach or small intestine. These ulcers can cause a gnawing or burning pain. Certain medications, especially non-steroidal anti-inflammatory drugs, or NSAIDs like ibuprofen, can also irritate the stomach lining and lead to dyspepsia. Infections can also be to blame for your tummy troubles. A common culprit is a type of bacteria called Helicobacter pylori, or H. pylori for short. This bug can live in the stomach and can lead to inflammation and even ulcers if it is not treated. Your doctor can test for this infection quite easily, often with a breath, stool, or blood test. If H. pylori is found, a course of antibiotics can usually clear it up and resolve the indigestion symptoms that it has been causing for you. Finally, our lifestyle choices and emotional well-being can play a huge role. Eating certain foods, particularly those that are fatty, greasy, or very spicy, can trigger symptoms in many people. Drinking too much caffeine or alcohol, or eating very large meals can also make things worse. And let's not forget stress. When you are feeling stressed or anxious, it can have a direct impact on your digestive system, slowing it down and making symptoms of dyspepsia more likely to appear or feel more intense. Most of the time, a bit of indigestion is nothing to worry about and will go away on its own or with simple changes. However, it's very important to know when you should seek medical advice. If your symptoms are persistent, meaning they keep coming back, or if they are severe and affecting your daily life, it's a good idea to have a chat with your GP. They can help you figure out what is going on and find the best way to help you feel better and get back on track. There are also some specific red flag symptoms that you should never ignore. If you are losing weight without trying, or if you are having difficulty swallowing your food, you should see a doctor straight away. Similarly, if you are vomiting, especially if there is blood in your vomit or it looks like coffee grounds, this requires urgent medical attention. These can be signs of something more serious that needs to be investigated properly to ensure you get the correct diagnosis and treatment. Another important warning sign to look out for is in your poo. If you notice that your stools are black, look tarry, or have blood in them, this is a signal that you need to see a doctor promptly. This could indicate that there is bleeding somewhere in your digestive system. Also, if you develop a sharp, sudden, and severe pain in your abdomen that does not go away, you should seek immediate help. Don't just try to push through these kinds of symptoms. It's always better to be safe. If you are over the age of 55 and develop new persistent dyspepsia for the first time, it is generally recommended that you see your doctor. This is mainly a precaution to rule out any other conditions. Your doctor will listen to your symptoms, might examine your tummy, and may decide if any tests are needed to get a clearer picture. Remember, your GP is there to help, so never hesitate to book an appointment if you are feeling worried about your health. Once you have spoken to your doctor, there are several ways to manage and treat dyspepsia. The first step often involves making some simple changes to your lifestyle and diet. Identifying and avoiding your personal trigger foods can make a massive difference. You might find it helpful to keep a food diary for a couple of weeks, noting down what you eat and when your symptoms appear. Common culprits include spicy food, fatty meals, chocolate, caffeine, and fizzy drinks. Eating smaller, more frequent meals rather than 3 large ones can also help. Simple lifestyle adjustments can also bring significant relief. For example, try to avoid eating for at least 3 hours before you go to bed, as this gives your stomach time to empty and reduces the risk of nighttime heartburn. If you are a smoker, quitting is one of the best things you can do for your overall health and your digestion. Reducing your alcohol intake and finding healthy ways to manage stress, such as through gentle exercise, yoga, or mindfulness, can also calm your digestive system down. If lifestyle changes are not enough, your doctor or pharmacist can recommend over-the-counter medicines. Antacids are a popular choice for quick, short-term relief as they work by neutralizing the acid in your stomach. Other medicines, such as proton pump inhibitors or H2 blockers, work by reducing the amount of acid your stomach produces in the first place. These can be very effective, but it's always best to use them under the guidance of a healthcare professional. In cases where a specific cause has been found, the treatment will be targeted to that issue. For instance, if an H. pylori infection is diagnosed, your doctor will prescribe a course of antibiotics and an acid-reducing medicine to clear the infection and allow your stomach to heal. The most important thing is to not suffer in silence. Dyspepsia is a manageable condition, and with the right advice and treatment plan, you can get your symptoms under control and start enjoying your food and your life again.